All right. This is our limited literature synthesis on huddles by group 11. So our PICO question is, in healthcare teams, does implementing daily huddles compared to no huddles or unstructured communication improve patient safety, team communication, and staff efficiency? So evidence one that answers this PICO question. So there was a study conducted across 4 pediatric wards that looked at what makes an effective huddle, and they were trying to develop a tool to evaluate the effectiveness of the huddle. So throughout this study, there were multiple performed at each phase, different huddle sizes and such. So the design of the study would be considered a quantitative study. This is because the tool is developed based on numerical data and was analyzed also based on numerical data. It was also a cross-sectional observational study. So the purpose of this study was to design a tool to evaluate the effectiveness of huddles. And then the results that came from the study was that there are themes that make huddles more effective, and then they can be added to a tool for further evaluation. So this is considered a level 3 study. And then I determined that this study was a low quality study as the results were not super generalizable due to a small and specific population size. So they only did 4 pediatric wards, and that can't be generalized to like adult hospitals and such and different units because I believe that they were all pediatric intensive care units. So the implications for future nursing practice and future research, this tool that they were able to study and create allows for individuals to effectively evaluate how effective a huddle is. And it's more of a standardized tool. It allows for future research to identify themes that make these huddles more effective and promote collaboration and such.
Evidence 2 that answers the PICO question. This is healthcare huddles managing complexity to achieve high reliability. This study took place in 3 healthcare settings across 2 institutions, an internal medicine clinic, a 40 med-surg unit, and a 577-bed pediatric hospital. Researchers observed 7 huddle types and interviewed 13 participants, including nurse managers and administrators. This is a qualitative ethnographic study observing huddles in healthcare settings and interviewing nurse managers and administrators to explore communication and teamwork dynamics. The purpose of this study was to examine how huddles improve patient safety and reliability in healthcare settings. The results of this study was huddles improve communication, strengthen relationships, and support a culture of safety. The findings showed that huddles helped promote high reliability practices by increasing awareness of daily operations, enhancing team resilience, and encouraging respect for each team member's expertise. Participants highlighted that huddles facilitated better coordination among staff and contributed to improved patient safety. The evidence level was a level 3, which is a qualitative, non-experimental observational study that uses interviews and observations. The quality rating was a grade high A. This is a high quality article using detailed observations, interviews, and multiple data sources to provide practical insight on improving communication, patient safety, and healthcare huddles. Implications for future nursing practice and future research. Nurse leaders should organize huddles to encourage teamwork and meaningful discussions. Huddles should focus on building relationships, clear communication, and safe practices. And research should explore how huddles can be adjusted for different units and team roles to improve teamwork and patient care.
For evidence 3, I used impacts of huddle intervention on the patient safety culture of medical team members in a medical ward. So the study was conducted in a healthcare setting, and it involved 61 healthcare workers who participated in the huddle intervention. And these participants were recruited through convenience sampling, so that means there was no random assignment or control group. The study design was quantitative, non-experimental study, and it used like a one-group pre-test, post-test design. The purpose was to assess the impact of a huddle intervention on patient safety culture by measuring changes before and after the intervention. The results of this study showed a significant improvement in patient safety culture after the huddle intervention. So before the intervention, the average safety culture score was 3.79, but after the intervention, it increased to 4.14. The p-value was 0.001, which means that this change was statistically significant. and it is unlikely to have happened by chance. And this shows that using huddles helped healthcare workers communicate better, work as a team, and become aware of patient safety issues, which led to a positive impact on the overall safety culture in the workplace. The evidence level, the study classified as a level 3 evidence, because it lacks randomization and a control group, so they made it a little lower in the evidence hierarchy. The study would be rated as a moderate to low quality due to limitations in the study design because they used a convenience sample without a control group. There's also a small sample size of 61 participants, which limits the generalizability of the findings. And then self-reported data, patient safety culture was assessed through participant responses, which may introduce response bias. And then some strengths that they had was despite that these limitations, the study provides valuable evidence supporting huddle interventions in clinical settings. So some implications for future nurse practice and future research. The study suggests that huddle interventions can improve patient safety culture by enhancing communication and teamwork among healthcare workers. And future research should focus on randomized control trials with larger, more diverse samples to confirm that confirm the findings and assess long-term patient outcomes.
The fourth study talks about how huddles are effective in improving the timeliness of discharges from the hospital. The population size is 4,134 patients, 1,471 in the intervention group, and then 2,663 in the control group, and it was a 627 bed care facility. It was doctors and nurses involved in discharge planning were the people who were implementing the independent variable. It was a randomized control trial, and the purpose was to determine if huddles helped the discharge process to move faster. In the groups where the team members huddled, discharge orders were posted by 10 a.m. 21.3% more often than if the team did not huddle, and physical discharge by noon was increased by 7.5% for teams that did huddle. This is a level 1 evidence level. It was a randomized control trial. They randomized whether the patient would be getting a huddle or not. It was a high quality study. There was a lack of randomization and a lack of flaws within the design of this experiment. The implications for this study are that the huddles are effective and at improving times of discharge for both posting orders and being physically discharged. It's important for hospitals who struggle with discharging effectively, and it shows that huddles are an effective method of improving discharge times and by extension, staff efficiency.
For evidence 5, I looked at a study that was helping to prepare nursing students for how to engage and participate in huddles. So the population size and setting was that there's 11 third-year nursing students who had listened to the Huddle podcast during clinical at a medical hospital. It was a qualitative phenomenological research design, and it investigated the effectiveness of how huddle preparation improves team communication. They were prepared on how to participate in Huddle and how that helps to improve interprofessional communication when individuals know their roles and are encouraged to speak up. This was a level 3 because it was a qualitative study based on interviews of the participants. So all the students were interviewed about their experience using the podcast to be prepared for Huddles and how they felt that better prepared them to engage in Huddles. It was a high quality rating because the study described how information was obtained. The researchers were aware of their bias and they acknowledged it in the article, and participants helped to shape the scope of their questions. For implications for future nursing practice, it's important to adequately prepare students to help them to appropriately engage in interprofessional teamwork and communication. This study can be used to guide nursing programs to encourage clear interprofessional communication and collaboration, which clear interprofessional communication is necessary to promote patient safety. And then for the summary of the limited literature synthesis, a few themes that we found throughout all of our articles were that huddles are effective when implemented, improved communication results in improved patient outcomes, and the components of what makes a good huddle. Our range of levels of evidence was 1 to 3. A few significant findings that we noted were that huddles were effective at improving staff efficiency, patient safety, and team communication, especially between multiple professions. Overall strengths and limitations were a lack of bias and quality of research, and a limitation was the population size and generalizability. For overall implications for future nursing practice, should be implemented training on effective components of a huddle. And for future research, it should look more into how huddles impact larger populations and over multiple different settings, like multiple hospitals and units. That's what we have for our limited literature synthesis.